Robert Butler, who was the founder of the NIA, the National Institutes of Aging, called me one time in 2002 or so when I was about 5 years into my practice and asked me to come attend a roundtable of gerontologists, the scientists that study aging, to sort of see what it was I was doing in this new anti-aging medicine that had gotten some publicity. I'd been on NBC, Today Show, and some other national TV shows. Little did I know I was sort of being brought in as a sacrificial lamb, somebody who's not necessarily doing what he should be doing. And, there was a lot of criticism of some of our approach. But one thing that he did say to me is, look, Joe, you seem like a pretty smart guy. Your patients are doing well. They feel well. And in fact, they did. And our practice was growing at that point. Mm-hmm. But he said, you call yourself an anti-aging physician. What are you actually doing to measure aging? Mm-hmm. And I thought to myself, well, they feel good. So, but just like somebody that's treating high blood pressure, how do you know if it's working? Until the person has a stroke, you don't know that it did work. So you have to measure the blood pressure. Well, how do you measure aging? And that started me on the journey that I'm still on and love, which is understanding and learning about biomarkers of aging and how you have to, in order to really know whether something's doing something, you have to be able to measure it. We have chromosomes in our cells that hold our DNA. It's all folded up into these neat little packages. In mammalian, DNA is linear, so it has ends to it. And that's a problem because DNA replication machinery, if it sees an end, it thinks it's a break in a chromosome and it starts to try to repair it. So the telomeres are these non-coding ends of the DNA that are repeats of the nucleotides TTA, GGG. They don't code for any proteins, so you don't lose anything when you lose them. And every time cells divide, they get a little bit shorter because the DNA polymerase, which is the enzyme that replicates DNA, can't replicate the ends of the chromosomes. So it's called the end replication problem in molecular biology. Then Cal Harley proposed the theory that it was the telomeres that were one of the major drivers of the aging process in cells. And so when they get critically short, they can't divide anymore. So, for instance, your stem cells, which reside in every tissue in your body, those are there. It's a very small percentage of the cells in, say, your liver or in your muscle, but they divide to replace degenerated cells that are cleaned up by your immune system. If they can't continue to do that, then they can't continue to, regenerate those tissues, and that's a major aspect of the aging process. But not only do they lose the ability to regenerate tissues, but once they become senescent, that's the term for a cell that can't divide anymore, they secrete these nasty inflammatory molecules called cytokines that we all sort of are familiar of now because of this cytokine storm from COVID. And particularly immune systems, when they get into that immune cells, when they get senescent, they start to secrete these inflammatory molecules that then not only make it a less effective immune system, but increase inflammation quite significantly. And we started this year-long cohort of patients that came through my practice and were on the protocol of supplements that we use in TA65 that was called the patent protocol. We generated a lot of data from that and learned that TA65, this molecule, was effective in rejuvenating the immune system, but we also looked at a whole bunch of other biomarkers at that time. And when we put them all together in an analysis, we found that it was a really good way to model the aging system. The future of medicine is to really get started early, see what's happening with your aging process, and then track it, treat, monitor, adjust. One of the successes that I see all the time in my practice is treating women who are perimenopausal or menopausal because estrogen is such an important molecule in them, getting rid of symptoms. I hear all the time from patients, you gave me myself back. The worst advice I hear is, we mentioned it briefly, which is that estrogen causes breast cancer. It doesn't cause breast cancer. How can an endogenous molecule cause breast cancer? The associations have been looked at. The risk in the largest trial turned out to be non-statistically significant in younger women and clinically insignificant. So to stop all the benefits because of that makes no sense. And yet you still hear that because of the disinformation that's out there. And then taking that in the morning, some time to do a little 15 to 20 minute meditation, put a little device on your head, and then it tells you whether your mind is active, neutral, or calm, and gives you immediate feedback into your ears as to which way you're going. And then you learn how to breathe into a calm state. and you don't have to wonder whether you're in a calm state. It tells you. One of my patients is basically a Buddhist, and she sits for hours. She's 83. Wow. She's on a lot of hormones and other things too, but her glycan age is 37. So it definitely helps. We are in biomedical sciences, just like it was promised in 2000 when we sequenced the genome. We thought everything was going to change, but we needed to learn a few more things. But right now, with this convergence of computing power, artificial intelligence, and our understanding of the aging process, I really think that we are going to be altering the landscape of medicine, disease, how we think about healthy aging, like the internet revolution that took place in the late 90s, early 2000s. That was a seminal part of what changed the biomedical revolution that was responsible for. And so I think that you should really start to get involved in this. Go to some of those websites. Don't accept aging as each year being able to do a little bit less, feel a little bit less well. That doesn't happen. I'm almost 62. I want to keep on functioning like a 40-year-old. And the final word is that slowing aging is not a theoretical problem anymore. It's just a technological problem.